Welcome to the We Level Up Treatment Center video series. In today's video we will discuss DPDR disorder. Do you ever feel like you're watching yourself from outside your body or like the world around you isn't real? These eerie sensations may be signs of depersonalization derealization disorder. While many experience them occasionally, those suffering from DPDR disorder are plagued by persistent feelings that interfere with daily life. If DPDR symptoms sound familiar, seek help and regain control of your life. The duration and intensity of DPDR can vary from person to person, and it can be a chronic condition that requires long-term management. Treatment options may include therapy, medication, and lifestyle changes. If you are experiencing DPDR disorder or other mental health concerns, seeking professional help from a qualified mental health provider is recommended. DPDR symptoms. Are you struggling with feelings of detachment and an altered sense of reality? You may be experiencing depersonalization derealization disorder. These persistent episodes can cause distress and difficulties at work, school, and critical areas of your life. While aware of the feeling, worry about losing touch with reality can consume you. This disorder is rare in children and older adults but typically begins in the mid to late teens or early adulthood. Don't suffer in silence. Seek help and support to regain a sense of stability. Depersonalization symptoms include feelings of detachment from your body and emotions, like a zombie or observer in one's own life. Reduced sense of physical and emotional sensations. Unable to concentrate, as though your actions are not real. Memories, behaviors, and surroundings are part of an unreal dream. Confusion and difficulty communicating. Estrangement from those around you. Being unable to recognize familiar people or places. Derealization is feeling detached from your environment and its objects and people. The world may seem distorted and unreal, as if you're observing it through a veil. You may feel like a glass wall separates you from those you care about. This aspect of disassociation can also create distortions in vision and other senses. How long do DPDR episodes last? DPDR symptoms can last for a few minutes or weeks and are often accompanied by anxiety. People with this condition do not lose touch with reality. They realize their perceptions aren't real. Depersonalization or derealization disorder can also be signs of other conditions, such as brain diseases, seizures, and psychiatric disorders, such as dementia and schizophrenia. Who does DPDR affect? Depersonalization disorder can affect people of all ages, although it is most common in those in their late teens and 20s. It is estimated that between 1 and 3% of the population experiences depersonalization disorder at some point. Causes of DPDR disorder? The disorder is thought to be related to stress, trauma, or a neurological problem and acute anxiety. It is believed that, in some cases, the disorder may be associated with a genetic predisposition. It has also been linked to psychological issues such as depression, substance abuse, or post-traumatic stress disorder. DPDR signs. Symptoms often include feeling like one is living in a dreamlike or foggy state, and perceiving their environment as unreal and distant. The self and the world are not real, or having difficulty expressing thoughts and emotions. Anxiety, panic attacks, and difficulty concentrating. Depersonalization derealization disorder symptoms are common in the general population. Some people experience mild, short-lived symptoms. Others have chronic, ongoing symptoms that may last for years. The symptoms may interfere with your ability to function. They may even lead to a disability. Depersonalization effects. Depersonalization refers to feeling detached from yourself, as if watching your life take place from the sidelines or viewing yourself on a movie screen. It can include alexithymia, or an inability to recognize or describe emotions. Feeling physically numb to sensations. Feeling robotic or unable to control speech or movement. Feeling unconnected to your body, mind, feelings, or sensations. Inability to attach emotions to memories or to own your memories as experiences that happen to you. The sense that your body and limbs are distorted, swollen or shrunken. The sense that your head is wrapped in cotton. Depersonalization derealization disorder, DPDR disorder. Risk factors. Some people are more vulnerable to psychiatric disorders than others. For instance, women are more likely than men to experience depersonalization, derealization, or some other type of dissociative occurrence. Severe stress, anxiety, and depression are common triggers for DPDR. A lack of sleep or an overstimulating environment can also make symptoms worse. Anywhere from 25% to 50% of the time, the stress that brings on depersonalization, derealization disorder is relatively minor or noticeable. Often, people with DPDR have experienced past trauma in their lives, including emotional or physical abuse or neglect in childhood, having a loved one die unexpectedly, witnessing domestic violence. Other risk factors for DPDR include a history of recreational drug use can trigger episodes of depersonalization or derealization, an innate tendency to avoid or deny difficult situations, trouble adapting to difficult situations, depression or anxiety, especially severe or prolonged depression or anxiety with panic attacks, experiencing or witnessing a traumatic event or abuse as a child or adult, extreme stress in any area of life, from relationships to finances to work. Depersonalization disorder treatment. Depersonalization disorder treatment typically involves using one or more therapeutic interventions to address different aspects of the disorder. Individual therapy is the primary depersonalization treatment, though medications are sometimes used in conjunction with therapy to treat the disorder. While derealization is considered a distinct aspect of this condition, derealization treatment is incorporated fully into interventions for depersonalization. Depersonalization derealization disorder can be severe and may interfere with work, relationships, and other daily activities. How to fix derealization? The primary DPDR treatment is talk therapy, psychotherapy, although medications are sometimes used. Symptoms usually begin in mid to late teens or early adulthood. Depersonalization derealization disorder is rare in children and older adults. How to fix depersonalization? One of the most effective treatments a DPDR specialist recommends usually involves some type of therapy, especially psychodynamic or cognitive behavioral therapy, CBT. Depersonalization disorder treatment outcomes. Depersonalization, derealization disorder, DPDR. Episodes can last for hours, days, weeks, or even months. Can derealization kill you? For some, DPDR attacks become chronic, evolving into persistent feelings of depersonalization or derealization that can periodically get better or worse, but it is not a direct cause of death. The outlook for people with depersonalization disorder is generally positive. With proper management and treatment, it is possible to reduce or eliminate the symptoms of the condition. With proper diagnosis, support, and treatment, many people can learn to manage the condition and go on to lead productive, fulfilling lives. Mental health therapy is a cornerstone in the treatment of depersonalization disorder. By engaging in regular psychotherapy, such as cognitive behavioral or mindfulness-based therapies, you can learn effective ways to manage and reduce symptoms of depersonalization disorder. In therapy, you can explore the underlying issues that may have triggered the disorder and develop coping skills to help you manage the disorder more effectively. Additionally, medications may be prescribed alongside therapy to reduce the frequency and intensity of episodes or to help manage associated symptoms, such as anxiety and depression. We Level Up can provide information on dual diagnosis, DPDR specialists, and medical detox programs that may fit your specific needs. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.